Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. International Nurses Day is observed annually on May 12th. Today, I have in studio with me a few nurses that is, and today we're going to talk about the evolution of nursing in Guyana. I'm now going to allow these persons to introduce themselves to you.
Thank you for having me. My name is Gwendolyn Tross, AA. In terms of what my accomplishments are, SCM, Diploma in Public Administration, Certificate in Advanced Nursing Education, Master's degree from the University of Liverpool, England. Founder of the BSc Nursing degree, University of Guyana. I think that's enough.
Thank you, Nurse Ross.
Thank you for having me on this program this morning. I'm Winifred Mardenborough-Zach, and I'm a nurse. Registered nurse midwife, health science tutors, BSc in nursing, Masters in Public Health from the St. George's University, and currently pursuing the doctoral studies in public health nursing at the School of Nursing in Ribeirão Preto, Sao Paulo, Brazil. I'm a lecturer attached to the University of Guyana, and also I am a member of the esteemed Sigma Tattoo Tau.
Thank you, Nurse Razak.
Thank you for having me, Alicia. I am Nadine Saunders. I'm a registered nurse midwife. I hold a certificate in public health affiliated with the University of Guyana and a Bachelor of Science degree in nursing. I am currently acting as the senior health visitor responsible for maternal and child health management on the East Coast corridor.
Thank you for joining me on this program today. Now, International Nurses Day 2022 is observed under the theme A Voice to Lead, Investing in Nursing and Respect Rights to Secure Global Health. Nurse Tross, we want to start with you first. We know that you have been in the nursing fraternity for over so many years. Could you tell us about some of the experiences from the past?
Okay.
What was nursing then?
Right. It's a pleasure to share because, as I said, my experience as a student nurse was limited. But during that limited period of time, I was impressed with the standards that existed, the discipline, the commitment to providing patient care, quality patient care. I know the focus then was on functions as against roles, because you talked about injection, bathing, what have you. So nurses, that was the category, what have you. But the discipline, even in terms of the uniform one wore, including footwear, and nurses were respected by the community as well as doctors. That was the impression I got as a nurse. Now, when I left, I left for England at age 19, and then returned after getting my state registered nursing and midwifery, and was involved with teaching before that. I was involved for 4 months on a surgical ward. Thereafter, I was moved to the eye department. And in the eye department, one had an opportunity to teach nurses about eye conditions and what have you. I suppose that was recognized, my, desire to teach. And so I was moved to the School of Nursing. A year after, I was moved to the professional nursing and became a tutor and then a senior tutor. And in those years, the chief nurse took a responsibility to ensure that we as tutors communicated with those persons on the wards, the ward managers. Students were assessed after each placement and a report sent to the tutors. And we as tutors had a responsibility to ensure that we examine those reports carefully and assist, mentor those students who are having problems. Apart from that, we had what is referred to as, what do you call that thing? A document which enables students to go through and to see if there's an emergency, how it should be handled and what have you. The emphasis on the nursing process. You had to go through the stages of the nursing process, and nurses had to report. So when the doctors came for a round, the document was there. The nurses had a responsibility. They saw it as a responsibility to be with those doctors. Now, recently, I was told, it just breaks my heart, that there the senior nurse was sitting at the desk. The doctor came to do the rounds and asked, and the nurse said, he asked, where's the chart? Look it up there.
Wow.
So, those are things that would not have been allowed. And apart from that, another important thing, we had persons coming from the UK, United States, to talk about nursing and encouraging you and enabling you. What impressed me most was a consultant by the name of Dr. Reed, a Jamaican woman. And I was the scribe during the meetings and what have you. And she was a woman, a no-nonsense woman. She enabled me, she pushed me up to learn about curriculum development, conceptual frameworks, and what have you. So much so that when I went back to England as a tutor, I was able to make an impression in terms of the curriculum development, statement of philosophy. So those were kinds of the enriching experience that I had here in Guyana.
Wow.
And I'm not, nurse will talk about whatever, but I'm not sure that is happening from the little reports I get and what have you. And it hurts me, because another reason for starting the degree program, while I was at the Georgetown Hospital as a tutor, we had discussions about starting a degree program and what have you. After going away for several years, went to Africa and all these places, came back, there was nothing for nursing. And so I discussed my problems, my anxieties with Dr. Cummings, who was then the dean, and he said, Mrs. Strauss, do something about it. This is how it started. So in 2002, we started the nursing degree program. And let me tell you, so many nurses, they were just waiting for the start. They're just waiting. We have nurses who are now doctors. We have nurses who are now consultants. As I shared earlier with you, one girl now is a senior lecturer at one of the esteemed university in England. She started her business. So all we want are nurses to be mentored and given an opportunity to explore and to rise up. And that is not happening. Because once you get all this education and what have you, the programs are not existent in terms of how they can, upward mobility, to encourage upward mobility. So those are some of my concerns.
For those persons who have just joined the program, we're talking today about the evolution of nursing in Guyana. I spoke with Nurse Strauss just now, and she just spoke a bit about some of what nursing was in the past. Now we're going to examine the present. What is nursing today? Nurse Saunders, could you tell us how a nurse is defined in today's world?
A nurse is an individual who would have received specialized training in that field and would have fit the criteria for graduation as regulated by a government appointed body and would have graduated. Her scope of practice, his or her scope of practice, that is then continue to be regulated by that body, and that's known as the General Nursing Council that we have here in Guyana.
Okay, what are the categories of nursing?
We have the professional nurse, who we call the RN, or registered nurse. We have the registered midwife, the registered nursing assistant, And under the umbrella of nursing, we also have patient care assistants, and in some settings, they may be referred to as nurse aides. Now, you may notice that for our midwives and our nursing assistants, we have registered in front of them. Those are the categories that are licensed under the General Nursing Council, and their practice is regulated, whereas our patient care assistants and our nurse aides function under the supervision of a licensed nursing personnel.
Okay, I want us to talk a little bit about the pathway to academic development. For those persons who are watching and wondering how I want to get into nursing, how can I do so? Could you tell us about some of those programs that are available and how could persons get academically qualified?
So I'm going to refer to only recently the advert that was put out by the Ministry of Health in relation to our programs, which I've just spoken on. However, after you would have become a registered nurse, there are many opportunities for professional development. We have nurses who return for post basic training in midwifery. So many registered nurses go on to do the post basic training in midwifery. Our midwives are called practitioners because they have the autonomy to take action and to administer certain medication in crisis and so on. So they enter that practitioner field and they become staff nurse midwives or registered nurse midwives. Our registered nurses, they can go on to do the Bachelor of Science in the nursing program thanks to Nurse Strauss, where they gain, I must say, benefiting from the program as well, a wealth of knowledge.
Wow.
It is instrumental, in helping us to adjust as leaders, as managers, and as innovators in our field. Many we've become researchers. We have been able to tap into that, that potential that we have to see how social determinants of health and other factors are influencing the outcomes in our society. We are able to create innovative ideas, as simple as it might seem, that could enhance a patient experience, that can enhance the experience for us as caregivers, and that gives overall good general outcomes. So those are some of the things that have come out of the BSc program. After a nurse may have fit the criteria of a staff nurse midwife, she can decide that she's interested in public health. She then goes on to do public health nursing, which is a degree program that is now affiliated with with the University of Guyana, And so she becomes a public health nurse, and her specialty is on community nursing, which focuses primarily on health promotion through education, collaboration with stakeholders, and immunization and so forth. So there's a broad umbrella under public health that they're able to tap into. We also have categories such as cardiac nursing. We have emergency nursing, mental health nursing, which is a program that is newly offered under the University of Guyana umbrella as well. So there is scope for development, and we have nurses who have moved on to pursue masters in public health and other related fields, and even doctorates. So the scope for nursing academically is vast, and it holds much promise.
Awesome. Nurse Saunders, could you quickly just touch on the roles and responsibilities of nurses?
So I'm going to focus primarily on what all registered nurses are supposed to do as the senior nurses. Nurse Strauss would have spoken to say that, nursing was a bit task oriented.
Yes.
Now we are more role oriented.
Yes.
And with that, we have adapted or adjusted to covering a variety of roles and responsibilities. And supervision is a significant part of that role, knowing that you have other junior nurses are being trained every year that come under us. So we have to supervise. But as it relates to patient care, client care specifically, we are responsible for identifying client needs, which is done through history taking, through interaction, and to plan care that is specific to our clients. Nursing is not just about acting on a specific treatment that was ordered by a physician. We assess, we evaluate, we plan, we implement. And those are areas that people don't really tap into or don't see the significance of. So, for example, you may have a client suffering from a particular ailment and they're given Panadol. We don't just give that Panadol. We assess your need for it. We make recommendation if it's not working. We educate you on the effects of it, on the importance of it. We do a lot of family education. So, and we ensure that all the care for a particular individual is coordinated. So we have nurses who are managing clinical settings as health centers. We have nurses who are managing wards. We have nurses who are managing an institution. We have nursing at each level that taps into the patient experience.
Thank you, Nurse Saunders. Nurse Ross, in your years of experience, do you have anything that you would like to add to what nursing is now based on what Nurse Saunders would have just mentioned?
Well, what I'd like to say, the education has moved significantly, nursing education. But one of my concerns, well, I'm very glad to hear what you are saying, because from little reports you get, the application of that knowledge sometimes is questionable. And we have a responsibility to ensure that our community, people in the community, receive the quality of care which is required. And I think one of the reasons, and this is from discussion with persons who have left. When I go to the UK, I communicate with them. It's that they do not have the opportunity to apply some of the knowledge which they gained, and they become frustrated. This is just from hearsay. And I think that we need to listen, because these are persons who have passed through. This is what they've been saying to me. Because, I travel to England, often, and I'm in touch with them. And this is what they say. So having all this education, and when you get back to the clinical area and you're not enabled to apply those things, you become frustrated and you want, there's no upward mobility. Strategies are not there for them to say, well, I'll be able to move up here, move up there, or whatever, or recognize in terms of salary. And I know research has shown that, money is not the most important thing. But in our present circumstances, it's very important.
Okay, so we have touched on the past, we've touched on the present, and now we want to talk a little bit about the future, Nurse Razak. But before we get into that, could you highlight some of the challenges that nurses experience in the system today, and what solutions are in place to overcome those challenges as we press towards the future?
Very well, dear. There are many challenges that nurses experience today in the system. As Ms. Saunders might have highlighted, and Ms. Strauss, that when they get back to their place of work, sometimes the opportunities to put into place the things they've learned may be limited. We are in a system where we are guided to some extent under the stipulations of the General Nursing Council and also the Nurses Association, tied into some of the policies that were drafted from the regional nursing body and the International Council of Nurses. So we know as a profession, what we do is not willy-nilly according to the schools or only according to our employers. Hence, we need to be given that chance to function at the level according to our vision, mission, and policies, which are not only local, but regional and international. Nurses who had pursued the BSN program will be presenting their research and their innovations. Now, as a part of the program, each nurse before graduation would have to complete a 8-credit innovation program, where in the institutions where they work, they complete a SWOT, looking at the area of need and create an intervention which they would implement within that institution. And at graduation, we award them prizes. So those persons who were awarded prize for innovations will be presenting at that seminar. Apart from that, nursing is not only, as you know, about sick care, as now we are tasked with quality, safety, and also we have to harmonize medical care. But more so, we are in the community looking after the well individual and family. So, for Nurses Week, the third year students have embarked on a school health outreach program where they are in a place called Denver in the Demerara River, Region 10. Now, the need was seen during the COVID-19 pandemic when students had to use the electronic means of reaching their school activities. Now in Denver, it's a farm community where there was no internet connection. And those students they have no library or no place to do their work. So the university students visited that area and they decided to help fund the completion of a little hut where they're going to put in a library and internet at some point. That hut is about 90% completed. Books have already been donated. We're still taking in donations. And that activity is going to be handed over next Tuesday to the community. And that's what we do, because for the years we've been traveling across the length and breadth of Guyana, doing seminars on child protection and promotion. And this year program will see Denver having a new opportunity for learning, not only for children, but the students intend to encourage some amount of education among the parents also, and especially the women in that community. So those are some of the things that we have planned, not only at the university, but in the community. And as I said, there are going to be many little programs like these in the hospitals and so forth for Nurses Week.
Nurse Trust, before we end today's program, do you have any advice for aspiring nurses and even nurses who are already in the system?
I just want to say that nothing is impossible. They have to understand that they have a purpose. Once you enter into nursing, you have a purpose, you have a responsibility, and there is nothing to prevent them from reaching the stars. It takes a lot of hard work, commitment, continuous education and learning. And what I would like to encourage nurses is to get together as a group to explore and discuss the challenges that they are facing, to become more au fait with policies, and to take an interest in what is those persons who are making decisions about nursing without any consultation, because nurses are not seen as able. I don't know if that is the perception, but nurses have a responsibility because they're in this profession, and once you come into this profession, you have a responsibility to yourself and to others. And I just would like to encourage them, just as how here, look, me, Raza, Saunders, right? We have contributed. I'm 81 and I'm here talking. So the limit is unlimitless, and they have a responsibility to improve themselves, to mentor others. And the ones in charge should be mentoring, encouraging, right? Because the sky is the limit. We have proved that. The sky is the limit. Many of our students are now doctors, consultants, senior, as I told you before, senior lecturers university in England from the BSc nursing. So that the sky is the limit.
Thank you, Nurse Ross. I want to thank each and every one of you for joining me on the program today. It has been quite informative, and I know so many nurses who would have been able to view and listen to this program. They're inspired by all of your words. So thank you so much for your service to the health system, and best wishes to you as you continue. Thanks once again.
Thank you for having us.
To you, our listening and viewing audience, thank you for staying tuned with us. This has brought us to the end of Health Matters. I'm your host, Alicia Martin, saying goodbye for now.